Just a few hours back, I was perfectly all right when I returned from the office, and then suddenly I started getting soreness in the throat, pain, coughing, sneezing, runny nose, and severe body pain and fever. Or few days after getting such an episode, I started getting a lot of pain around my cheeks and forehead. So whenever we are discussing such scenarios, we are typically talking of infections which are due to droplet borne or airborne routes, which are fairly common during the months of monsoon also. So friends, here I am Dr. Piyush Chaudhari getting to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases. In this infection, we are going to discuss an important category of infection which are transmitted through airborne or droplet borne routes. So essentially, whenever a person is suffering from any respiratory tract infection, predominantly upper respiratory infection, where there is a lot of runny nose, sneezing, coughing, sore throat, when the person talks, sneezes or coughs, he or she releases a lot of particles or droplets in the air, some of which travel of several feet, some of which get mixed in the air, and then they can transmit the infection to anybody who is coming in contact with such an air or droplets. Now, as the root suggests, the predominant symptoms in this category of infection is respiratory. Luckily, most of these are upper respiratory, so limited to the throat, nose, sinuses, and upper airways. Occasionally, some of them may end up infecting the lungs, causing what we commonly term as pneumonia or lower respiratory tract infections. Now, the most common examples of this infection are seasonal flus or more severe forms of flus like H1N1 influenza, H3N2 influenza, or the more recent COVID-19. These are the infections, or there are several other viruses which cause upper respiratory infections like adeno, rhino, and so on and so forth. Now, what is one thing which I would like to stress upon when it comes to these respiratory infections is that more than 95% of them are viral in etiology. So, in other words, in more than 95% of these infections, we do not require antibiotics for getting cured. Something very different from the actual scenario that happens. Why that happens and why it is fixed in our brain, I'll tell you. Because typically in these infections, the first 40 to 72 hours are dominated by symptoms like extreme malaise, fatigue, body pain, joint pains, headache, and high grade fever which keeps coming repeatedly. So every day the person may have spikes of fever every 4 to 6 hours, ranging even up to 103, 104 degrees. But as we move towards day 3, day 4, day 5, the intensity of these symptoms keeps going down, and by day 5 to 7, most of the cases, these symptoms would have subsided completely. Parallelly, the person may have sneezing, runny nose, blocked nose, pain in the forehead, or congestion in the sinuses, followed by coughing, which may be dry or productive, which may remain a little longer than the fever and body pain remains. But what happens is whenever we get these symptoms, first day we maybe take a rest, take some paracetamol, some painkillers and wait. Second or third day, typically we start to lose our patience and we go to a medical store or a general practitioner, or sometimes on our own through our Google search, we start some antibiotics. Now these antibiotics are typically azithromycin, amoxicillin, clavulanic, cefodoxime, and so on. And we typically, if we say, we consume this antibiotic somewhere around that day 2, day 3, or at times day 4 period, where actually in the natural course of the infection, the symptoms were about to decrease. And because they decrease, we feel that maybe it decreased because this particular antibiotic was taken. So that gets registered in our brain that I took this X antibiotic and my symptoms improved within a day, whereas they were not improving in the previous 2 days or 3 days. Now, furthermore, once the symptoms improve, we don't complete the course of that antibiotic, keep the leftover antibiotics in our medicine box. The next time, the moment we get such a symptom for the first day, we pop up that pill, even before we take actually symptomatic treatment, which is mainly the antipyretics and decongestants. And this process goes on repeating several times, and then it becomes a habit that whenever my throat pains, I go to the chemist and take a azithromycin or amoxicillin or amoxiclav, because I feel that only that will reduce my symptoms. But friend, this is absolutely wrong, and this in fact is one of the major reasons why in our country antimicrobial resistance is on the rise. Because whenever we use these antibiotics when they are not actually warranted, we end up causing a lot of collateral damage in terms of development of resistance in the bacteria which are commensals in our intestines or various other organs and in the environment. And later on in our life, when we actually happen to develop some serious bacterial infection, we often come across reports these days where most of these common antibiotics have been rendered ineffective because of development of antibiotic resistance. So I would like to highlight this one more time, that please don't waste these important weapons in form of common antibiotics against bacterial infection when we use them unnecessarily for viral respiratory infection. Okay, then what should we do? So what essentially a person suffering with this kind of infection requires is only symptomatic relief. So adequate rest, healthy nutritious food, avoiding anything which is oily and spicy and which can irritate your throat, maintaining adequate hydration, and symptomatic treatment. So if you have fever, we can take paracetamol or other antipyretics. If the body pain fever is more, maybe a day or two, we can take some little more powerful painkillers. Antihistaminic or decongestant drugs which reduce the congestion in the nose and sinuses and reduce our throat related soreness. Cough syrups, depending upon whether it is dry cough or productive cough and whether there is any accompanying asthma like symptoms or not. Other than this, steam inhalation, consumption of lukewarm water, then gargles with salt water and turmeric, or gargles with betadine liquid, these things can help. In cases where throat pain is quite severe and where it makes it difficult to swallow routine non-spicy food as well, we can at times perhaps try something like a discrete tablet in water for gargles, where we are gargling and throwing it out, not consuming the tablet, but to reduce the congestion in the throat at least for a while so that we are able to consume food normally. Apart from this, most of these infections do not require any further treatment. Then which ones require? So in a small percentage of people, when this infection is caused because of infections like H1N1, that is a time when antivirals like oseltamivir may be warranted. Again, not 100 out of 100 patients getting H1N1 infection require oseltamivir. Who requires is mainly elderly elderly patients who are above 65 years of age, pregnant ladies, diabetic patients, patients who have chronic lung, liver, kidney or heart related diseases, or patients who have weak immunity owing to any medical condition or owing to certain treatment modalities which may be impacting their immunity. So in this group, because the risk of complication in terms of infection extending to the lower respiratory tract and causing pneumonia or ARDS, warranting oxygen therapy, ventilator support, etc. These are the groups where oseltamivir within first 48 to 72 hours of symptom onset can help. Additionally, in the population which do not have these risk factors, if their severe high grade fevers etc continue beyond 2 days, they may benefit from taking antivirals like oseltamivir with respect to reducing the viral load, as a result reducing transmission of virus to other contacts around them, and minimizing the symptoms faster compared to somebody who is only on symptomatic treatment. Beyond this, in none of the viral upper respiratory infections, antivirals are warranted. Here, I am not going to talk much about COVID because of various different myths and facts related to COVID, which entirely requires a different dedicated video. Now, coming to sinusitis. Now, this is another scenario where patients come to us and they say, Doctor, whenever I get cough and cold, I eventually end up getting sinusitis, so please give me antibiotics. Or, furthermore, commonly, people come to us, Doctor, I can't take more than a day's leave. I have an important assignment, important meeting, important exam, etc. Please give me something. But friends, here we need to stress to them and explain to them that antibiotic is not the solution. Ultimately, the best way to treat viral infections is adequate rest and healthy nutritious food. Nothing else can replace that, not even your top-end, top-notch antibiotics. Coming to sinusitis, wherein typically there is pain around the cheeks, forehead, pain behind the eyes at times, sometimes dizziness. Now, when it comes to sinusitis, more than 50% of patients recover without any specific antibiotic therapy by 3 to 5 days. In the remaining ones, there are certain clues which can help us decide that this person may be having bacterial infection and we have to administer antibiotic. So what are those clues? if the symptoms of sinusitis do not reduce even up till 10 days, if the symptoms are severe and they do not reduce by 3 days, if the person has unilateral purulent nasal discharge, so only from one side, and purulent nasal discharge, if there is a molar tooth infection or gum related infection accompanying sinusitis, if there is facial edema on the affected side with a lot of redness and warmth locally, in these situations antibiotics are absolutely necessary and should be immediately administered. In the rest of them all we require is symptomatic treatment and adequate rest. Coming to tonsil infections, similarly there are clues like pustules over the tonsil or fever extending beyond third day, which may point towards streptococcal throat infections where antibiotics are necessary. In most other cases, even with extremely inflamed and enlarged tonsils, even with membranes being present on the tonsils, and even being swallowing being extremely difficult, it could still be viral in more than 90 to 95% of the cases. So, symptomatic treatment, rest, and no antibiotics. Again, bottom line remains prevention is always better than cure. So against some of these infections, like mainly the influenza group, there is a vaccine available. Now, unlike the COVID vaccine, the flu vaccine has been around for several decades and it has been used world over after having been proven useful and safe across multiple phases of clinical trials. So currently what we get is a quadrivalent inactivated influenza vaccine which has the 4 latest strains of this influenza group of viruses, including the H1N1 pandemic influenza virus, which are more prevalent in our surroundings that particular or the preceding year. So basically there are multiple viral surveillance network centers across the globe which provide this information as to which strains of these viruses are commonly in the circulation, and the latest vaccine becomes available in the market typically end of April or beginning of May. And if we see in a country like India, unlike US, Canada and all, there are two peak seasons of influenza infections. One is during peak of monsoons, somewhere between June, July till September, and one is during the peak of winter, so somewhere between October, November up till maybe Jan or Feb. Therefore, in all this susceptible group of patients that we discussed before, this flu vaccine should be compulsorily given every year, preferably end of April or May, latest by 1st of June, because after taking the vaccine, it takes around 14 to 21 days for adequate antibody level and the resultant immunity from developing. For other people who do not have these medical risk factors for complication, but if they are in a situation where they are more likely to catch infections, they can also take flu vaccine annually. Ideally, everybody should take flu vaccine because there can be a lot of subclinical cases which can indirectly spread infection to the susceptible people, putting them at risk, because these infections have a very short incubation period, large number of subclinical cases, many susceptible people around us. Again, the rest of the measures are related to hand hygiene, which we have discussed very often in last 2 or 3 years. Second is coughing etiquettes. So here again, whenever the patient is having sneezing, coughing, running nose like symptoms, so we should always sneeze or cough across our arm, within the shirt or t-shirt, or using a handkerchief or a tissue paper over our mouth and nose. Two important things: do not use directly your palms for covering mouth or nose, or if you do use, then wash them immediately, because otherwise we are touching so many surfaces around us which can still lead to transmission to others coming in contact with those surfaces. At the same times, do not use the same tissue paper for longer time, because it will again spread the infection to your hands and resultantly in the surroundings. Other than this coughing etiquettes, if we have to keep away these infections, then we have to keep 1 hand distance or 3 meter distance from 3 feet distance from anybody who has symptoms. Any person who has symptoms should avoid crowded places. During outbreaks of such infections, any susceptible people should also avoid social gatherings and crowded places. If anyone has symptoms, they should better stay home a day or two, or till the isolation period is over, so that they prevent spread of infection to others in contact with them. So friends, again to summarize, try to prevent these infections as much as possible. Avoid antibiotics in every upper respiratory infection, if not for the typical risk factors or factors suggestive of bacterial etiology. And if you have liked this video, please do share, like, and subscribe the YouTube channel of Fever Care Center for Infectious Diseases. And don't forget to mention in comments which topics you would like us to discuss about. Remember, stay informed, stay healthy.